I'm Dr. Kuelker, and I'd like to tell you about setting up my private practice. Now, I faced a few challenges in doing so. I had just moved 200 miles. Secondly, I knew 6 people in the new city. And third, there was other things going on in my life. I've got a daughter with autism, and I had to keep up with her therapy so that she could continue to improve. So I needed to build my practice from the dirt up. Now, I tried a couple of different things. I tried social media, and it didn't bring in the results that I was hoping for. And I tried something else, and again, it just didn't bring in the clients. And then I hit on an approach. I met with referral sources, gave them a presentation, and as a result, I drew in 25 clients in 55 days. I'd like to share that with you so that you can grow your practice as well.
What I did was that I met with referral sources and I explained how I use 21st century processes and resources in my work with clients. And that's what helped draw in 25 clients in 55 days. Well, let's dig down now into seeing exactly what I did. What I did was that I met with physicians, lawyers, clergy, vocational rehab consultants, and I showed them the 21st century processes that I use in my practice. So, for example, I'd phone up the office, arrange lunch with the vocational rehab consultants or the clergy or the physicians. I'd come in and I'd show them the slideshow. And this is exactly the same set of slides that I walk them through. You'll be able to see precisely what I told them. And I explained to them that I was in private practice, and about 2.5 years ago I ran into an article on psychotherapy, and it was like getting hit by lightning. And this article said that the vast majority of psychotherapy is done by the therapist just asking how the client is doing. And the article said what we need to do is measure each and every session. We measure 2 things. First, the client's level of psychological distress, and measure their sense of teamwork with the therapist. So, just measuring 2 simple things. Is a client getting better? And do they feel a therapeutic alliance with the therapist? The reason that this is so critical is because the therapeutic alliance is the single most important predictor of whether a client gets better in therapy or not. It doesn't matter so much as to whether you use cognitive behavioral therapy or narrative therapy or solution-focused therapy. What really matters is the sense of teamwork that the client feels to you. And so Jeff Reese was the first person at the University of Kentucky to do the research into this approach. And the way that he did the research was very simple. Every therapist in his study, half their clients were randomly assigned to the old way of doing therapy. So the client would come in and the therapist would just ask, "How are you doing today?" The other half of the clients in the therapist caseload would receive the scales. Each and every session they'd fill in the measures as to their level of psychological distress and the sense of teamwork that they felt with the therapist. So let's take a look at what happens when therapists measure each and every time. We saw that in the verbal inquiry condition, which is the way the vast majority of psychotherapy is done today, clients improved by about 5 points on a 40-point scale of psychological distress, which is pretty good. However, if the same therapist handed out the scales to the other half of their caseload, then clients improved 10 points on a 40-point scale of psychological distress. This is a doubling of the effectiveness of psychotherapy. And these results were so significant that Jeff Reese thought he should run another study. After all, replication is a hallmark of science. So in the second study, clients improved by about 6 points on a 40-point scale of psychological distress. But if the therapist handed out the scales to the other half of their caseload, then those clients improved 12 points on a 40-point scale of psychological distress. These were amazing results. And some psychologists wanted to see if they applied in the field of marriage therapy, because they were done here in the field of individual therapy. So they ran the largest randomized clinical trial ever done in the field of marriage therapy. And it was published in the top journal in the field of clinical psychology. When I meet with physicians, I tell them it's like getting published in JAMA or Lancet. And they kind of nod because they know how important these journals are in the field of medicine. I explained that the researchers set up the research design in the same way. Every therapist in the study, half their clients were randomly assigned to verbal inquiry condition, which is the way the vast majority of therapy is done in North America. The other half of the couples that came in for marriage therapy, they were randomly assigned to the objective feedback condition. They filled in the scales showing whether they're doing better and their sense of teamwork with the therapist. Let's look at the results. So this first slide shows the happiness levels of the couples. And this is the percentage of couples where both of them were happy. We can see that in the verbal inquiry condition, here in the green, that only 10% of the couples said both of us are happy, which meant that in the other 90% of the couples, at least one person was still miserable. However, if the couple was in the objective feedback condition, then 40% of the couples said both of us are happy. And when I'm doing these presentations, I love watching the eyes of the physicians when this slide goes up on the screen. They literally pop open with astonishment at the results. Then I try and backpedal it a bit because the results are so remarkable. I say, you know what? They wanted to see if these results held up over the long time or whether the conflict in the marriage emerged all over again and the couple went back to fighting. So they did a 6-month follow-up, and they found at 6 months that 12% of the couples in the verbal inquiry condition said both of us are happy. However, if the couple was lucky enough to be in the objective feedback condition, then 36% of the couples said we're both happy. These are very remarkable results. However, they only tell half the story, because in marriage therapy, what you really want to know is the separation rate. So 6 months after therapy ended, if a couple was unlucky enough to be in the verbal inquiry condition, which is the way a lot of marriage therapy is done, then 34% of them had split up. However, if the couple was lucky enough to be in the objective feedback condition, then only 18% of the couples split up. What's amazing is that there was a doubling or even a tripling of the effectiveness of marriage therapy just if the therapist measured or didn't measure. Often the physicians will say, well, why do you think there was such a big impact? And I love using an analogy that makes a lot of sense to people. I say, well, one example would be if you ask a carpenter to build you a chest of drawers. And he comes to your house and he hammers and he measures and he saws and he nails things together. Lo and behold, at the end of the day, you have yourself a nice chest of drawers. And then I say, suppose you ask the carpenter to come back the next day, build you another set of drawers. And you hand him some wood and you say, okay, this time build a different set of drawers and different design, but this time you can't use your tape measure. You just have to you have to guess if it's 60 degrees. You have to guess if it's 17 inches. Well, what do you think that chest of drawers is going to look like? Exactly! And everybody that can understand that if a carpenter measures each and every time, they're going to produce superior results to somebody who just guesses it and eyeballs it. And I believe that exact same process is present here in psychotherapy, that if you measure each and every time, you're going to produce far better results than if you're just guessing it and trying to eyeball whether the client's getting better or not. Assessment instruments are very easy to use, and I show them in my presentation. Here, it takes 30 seconds or a minute for a client to click on the line and indicate how they're doing in terms of their personal well-being, their close relationships, and they just go click, click, click on the line, and you've got a valid and reliable measure of psychological distress. And then I explain about 3 minutes before the end of the session, I have the clients fill in a measure of the sense of teamwork that they feel with me, and whether they feel heard, understood, and respected, whether we worked on their goals, whether my approach is a good fit. And if any ruptures come up in the sense of teamwork, then we're able to address it and repair that sense of teamwork. This also helps optimize word of mouth about you, because you're picking up on any ruptures in the sense of teamwork and fixing them before the client walks out the door. As a result of measuring each and every time, graphs are produced. And this is the graph of the very first client that I saw when I moved to this new city. This person came in psychological distress, and the dashed red line here is the clinical cutoff. They would sleep for about 2 hours, wake up, pace the house a bit, go back to sleep, sleep for another 2 hours, wake up, wander around the house for another hour, try to go back to sleep, maybe catch another hour, hour and a half of sleep, and then they'd be up again. And they ground their teeth all the time. They had a non-stop headache. So clearly they were in distress. And between the first and the second session, they made about the average amount of improvement for clients. Now this software is used by the US Navy, so we've got a good idea of how clients progress in psychotherapy. And the average client, their progress is marked by the orange line here. Client at the 25th percentile, they're at this grayish green line here, and the client at the 75th percentile, their progress is at the yellow line up here. So this lady made about the average amount of progress between the first and the second session. However, between the second and the third session, they made very significant improvement. They actually reconciled with a friend that they'd been estranged from for a couple of years. And I mean, kudos to them. They really took that step and improved that relationship. As a result, you can see that they were feeling far better. And they came in and they were so happy. They said, you know what, Dr. Kuelker, last night I slept for 6 hours in a row. My headache is gone. I've stopped grinding my teeth. I feel so much better than I did before. And 4 days after our last session, they wrote back and said, you know what, thanks for your professionalism. I don't need your services anymore. So I wrote back and said, well, have a nice life. I tell physicians that if you refer a client to me, then I'll send these graphs back to you so that you can have information on how your patient is doing. And physicians really appreciate that, because one of the things is that they're often asked to make decisions about whether somebody is ready to return to work or how they're doing. This gives the physician the information that they need. So, for example, in the first session, clearly this person was not ready to go back to work. In the second, they were doing better, but they still weren't above the clinical cutoff. However, in the third session, they'd made very significant progress. And so the physician probably wanted to monitor this person for another week, and if they consolidated their gains, they'd be good to go back to work. This sort of information is so valuable for vocational rehab consultants. They also have to make those kind of decisions about whether somebody's ready to go back to work. Also measure the sense of teamwork. And what's really interesting is that this lady and I did not start off in perfect harmony. I mean, look at it. She was below the dashed red line in terms of her rating of the therapeutic alliance with me. She was flagging that there was a problem. However, I was not worried, because I knew that if I increased the sense of teamwork with her, developed a closer working relationship, then she would do very well. And sure enough, between the first and the second session, there was an improvement in the sense of teamwork. And between the second and the third session, there was a sharp improvement in the sense of teamwork. I actually believe that this is what holds back many therapists from measuring the therapeutic alliance, is their fear of what happens if a client gives me a low rating. I know that was the case for me when I introduced the scales. I felt anxiety. What if clients gave me ratings that said, in essence, you know, you should be a bus driver? Like, it didn't make sense. I had a full practice and people said nice things to me, but I still remember that fear. I discovered since then a number of really cool tips and tricks to help therapists get past that fear of feedback, take their practice to the next level, and help their clients more than ever. And I'll share them with you in the future. This information on the sense of teamwork is also important to physicians, because they want to know if the person is getting better as a result of good sense of teamwork or what's going on with therapy. And because you send the data back to the physicians, you really stand out in the mind of referral sources. In fact, I've had physicians tell me the same 4 things over and over and over. They said, first, we've never had a visit from a psychologist in the city. Secondly, they said, we've never had a psychologist measure on a consistent basis with their clients. Third, they say we've never had a psychologist send us graphs back as to how our patients are doing. And then the final thing they say is, well, we'll refer to you from now on. That really shows that they value this kind of information very highly. One of the neat aspects as well is that because I'm measuring all the time, I'm able to collect data. And I've collected data for about 2.5 years. This data is on about 250 different clients, and I'm able to compare my data with other samples of psychotherapists in the research literature. So for example, here's a sample of EAP counselors, and in this study their effect size was 0.37. University Counseling Center, they found their effect size was about 0.6. There's been lots of research trials on psychotherapy comparing narrative therapy to cognitive behavioral therapy, or solution-focused therapy to short-term psychodynamic therapy, and in these research studies they find that clients improve by about 0.8 of a standard deviation. My effect size has hovered around 1.5, 1.6 of a standard deviation. Actually, it's not that surprising, because here we see that the therapists in the research trials have an effect size of 0.8, and the research studies that we showed before demonstrate that as soon as you measure, you double your effectiveness. So therapist effect size is 0.8, and I measure, it's no surprise that my effect size is doubled. It's around 1.5, 1.6 of a standard deviation. And I just leave that graph up on the screen so that when I'm talking to the vocational rehab consultant or the physician, they're able to look at it. Let's look at some of the results from this presentation. I got an email from a client, and this person wrote, and this is an exact quote, "My GP was impressed by your presentation, and a few of her clients have had success with you." Imagine the physician is telling their patients, "Wow, this Dr. Kuelker gave me a presentation that really knocked my socks off. Go see him." I believe that you can have the exact same results as well. If you incorporate this into your practice, pretty soon you'll be able to produce graphs like I just showed you, and you'll have an impact on referral sources, just as I've been demonstrating as well. Well, we've been looking at the 21st century processes. I also promised to tell you about the century resources that I use in my practice. Now, what do I mean by this? What this is the largest interactive portal on the internet for the clients of social workers, clinical counselors, marriage and family therapists, psychologists, and other mental health professionals. Let's take a look at all of what's in the portal and how you can incorporate this into your practice. So this is the Mental Health Pros portal, and the way that I use it in my practice is that about every day or so, or every couple days, I get an email, and the email reads something like this. "My doctor says I've got post-traumatic stress disorder. I'm contacting 2 or 3 therapists to find out who's the best to work with me. Is this something that you deal with?" And what I do is I email them back and I say, "Well, since you're interested in working with me, here's a passcode to the largest portal on the internet. Just use your passcode, log in, then go to the tab on trauma and abuse, and you can read articles, PTSD. You can also take assessments on your level of symptoms that may be linked with post-traumatic stress disorder." And yes, we've got the disclaimers that these are not diagnostic. Diagnosis can only be arrived at with a qualified mental health professional. And then I also encourage people to go to the tab on stress and anxiety, the stress workshop, and that way they can learn about how stress is created, how stress affects you, how to build stress resilience. This is a mix of videos, text, assessments, and other things that may be very helpful for clients. They can also journal in the portal, take other assessments. There's lunch and learn workshops, many other resources. One of the resources in the portal that's really helpful is the monthly newsletter that goes out. You just set it and forget it, because every 30 days it'll arrive in your clients' email inboxes. And you can personalize it with your own logo, such as Dayspring Counseling. And when you open up the newsletter, then it's filled with helpful information for your clients. So for example, it's got articles on mental health or relational health. It's got articles on physical health, recipes, links to other resources in the portal. So when you bundle this all together, we can really see that this helps create a stream of clients into your practice. The extra resources in the portal set you apart from every other therapist that person is going to contact. Because the other therapist will just say, yes, I treat PTSD, call my office for an appointment. You'll be able to give them resources that deepen and facilitate their healing. Also, the monthly newsletter keeps clients aware of you in a polite, unobtrusive way. The increased effectiveness really draws clients in as word starts to spread about the work that you do with clients. You really optimize your word of mouth as well because you're measuring each and every session and you're picking up and repairing any ruptures in the sense of therapeutic alliance. And as we've seen, you'll have greater credibility with referral sources by measuring and following up with the referral sources. Obviously, you'll want to have help in getting this news out. So I wrote an ebook for you on how you can write websites that draw clients in. Because when I looked at various therapist websites, I saw that there was things that they could do to get this good news out that would really help clients to engage with them and to be drawn into their practice. So you'll be able to receive that as well if you choose to work with us. Know that there's been a lot of information presented. Don't worry, I will coach you up to the next level. This happens in a number of different ways. We've got 9 videos in the Practice Transformation System that you can watch anytime that you want if you choose to join us. As well, I'll give you live coaching on how you can incorporate these changes into your practice. I'm the psychologist who's really discovered the tips and the tricks and the unique things that you can do to bring this into your practice, connect with referral sources, help yourself to stand apart from others in the community. My name is Dr. Eric Kuelker. My passion is to coach you as therapists to help your clients more than ever before. I look forward to working with you.